So now I'll be demonstrating the radial and anti-radial survey. We will begin the survey in a longitudinal plane with the breast at 12 o'clock. The marker is on the nipple and we'll be rotating in a circular fashion, following that nipple as the pivot point and just rotating around, making sure that the transducer is central to the nipple and back to 12 o'clock. So we would then repeat that movement. We would move superiorly with some slight overlap on both of those planes to make sure that we don't miss any lesions or breast anomalies. So again, we're just going to be rotating in a clockwise fashion, making sure that we heel toe and not lose contact with the breast tissue, and all the way back up to 12 o'clock. We would then again repeat that scan so that we have two of each, moving laterally but still facing the nipple. We would then do our last plane and moving again in a clockwise fashion all the way around, with some slightly coming out of the breast tissue there to make sure that again no lesions or anomalies are missed, back up to 12 o'clock. And again, repeat that. So that is the radial scan. So now showing the anti-radial, we've got the marker facing the patient's right and we are in a transverse plane at a perpendicular angle. We'll be moving for the anti-radial plane. We're going to be moving from inferior to superior. So just moving up, inferiorly, superiorly, and as you can see, starting at 12 and just repeating that scan all the way around, medially to the nipple, superiorly, and then back towards the nipple. So we'd rotate all the way around to 5 o'clock. Once we get to 5 o'clock, we move the marker back towards the patient's right so there's no confusion, and we move laterally, medial, all the way around, just coming out of the breast tissue slightly, so contour content, all the way back up to 12 o'clock to where we started. So we would image at 1 o'clock, 3 o'clock, 6 and 9. We would also remember to image the nipple and the axilla, and that is the entirety of the radial and anti-radial scanning planes.